Today, we're bringing you a crucial health update that every senior and caregiver should hear. We all know that vegetables are celebrated worldwide as the cornerstone of a healthy diet. They're packed with essential nutrients like fiber, antioxidants, and a wide range of vitamins that support overall well-being. But here's the catch. What's generally healthy for the average adult isn't always ideal for everyone, especially seniors. As we age, our bodies undergo significant physiological changes. Our metabolism slows down, our digestive systems become more sensitive, and many seniors are often on medications that can interact with certain types of food, especially vegetables. We commonly think are safe. Yes, it may come as a surprise, but not all vegetables are harmless. In fact, some of the most commonly recommended vegetables can potentially pose hidden dangers for elderly individuals, particularly those dealing with cardiovascular conditions, such as high blood pressure, heart disease, or those taking blood thinners or other heart-related medications. These interactions can affect how the body absorbs nutrients, how medications perform, and in some cases, may even trigger negative side effects such as increased blood pressure, irregular heart rhythms, or dangerous spikes in potassium levels. So, it's essential to go beyond the usual blanket advice of eat your veggies and understand how specific vegetables can interact with aging bodies and existing health conditions. In this video, we're going to highlight 5 specific vegetables that, while nutritious in general, can have unintended consequences on heart health in seniors if not consumed with caution. Whether you're a senior yourself, a caregiver, or simply someone who wants to help an older loved one stay healthy, this deep dive could be a game changer for managing long-term cardiovascular wellness. Spinach, a green giant with hidden risks. Spinach is often hailed as a superfood, and for good reason. It's a nutritional powerhouse brimming with essential vitamins and minerals like vitamin A for vision, vitamin C for immunity, iron for energy, folate for cell repair, and of course powerful antioxidants that fight aging and chronic disease. But despite its glowing reputation, spinach isn't without its caveats, especially for older adults managing specific health conditions or medications. One of the most important concerns for seniors revolves around spinach's very high vitamin K content. Vitamin K is crucial for healthy blood clotting, but this becomes a double-edged sword for individuals taking blood-thinning medications such as warfarin, Coumadin. These anticoagulants are often prescribed to prevent strokes, heart attacks, or deep vein thrombosis. But when you consume foods high in vitamin K, like spinach, it can throw off the balance these medications are designed to maintain. A sudden spike in vitamin K levels can reduce the effectiveness of blood thinners, increasing the risk of dangerous blood clots forming in the arteries, potentially leading to life-threatening cardiovascular events. And that's not all. Spinach is also high in oxalates, naturally occurring compounds that can bind to calcium in your digestive tract. This combination forms calcium oxalate crystals, which are the leading cause of kidney stones. Seniors, particularly those with declining kidney function, are already at a higher risk for kidney complications, and a high oxalate diet can intensify that risk. Furthermore, oxalates may impair the absorption of key minerals like magnesium, zinc, and even iron. Ironically, despite spinach being known for its iron content. So how can seniors enjoy the benefits of spinach without the risks? Recommendation: the key is not to eliminate spinach entirely, but to maintain consistency. If you're on blood thinners, it's essential to keep your vitamin K intake steady from week to week. Wild fluctuations. 1 week of eating lots of spinach followed by complete avoidance can disrupt your medication's effectiveness. Always consult your healthcare provider or a registered dietitian before making any changes to your diet, especially if you're on heart or kidney-related medications. In summary, spinach remains a highly nutritious food, but seniors need to be extra cautious. It's not about fearing spinach. It's about understanding how it interacts with your health profile and making smart, informed decisions. Pickled cucumbers. Crunchy but high in sodium, pickled cucumbers, especially the classic dill pickle, are a beloved snack for many. They offer a satisfying crunch and a zesty, tangy flavor that can brighten up any sandwich or charcuterie board. But while pickles might seem like an innocent addition to your plate, they can pose a serious hidden threat to heart health, especially for older adults. The main culprit? Sodium. Just one large dill pickle can contain up to 1,000 milligrams of sodium, which is nearly half of the American Heart Association's recommended daily sodium limit for seniors. That's a significant amount from just a single food item. For people over 60, the recommended limit is around 1,500 milligrams of sodium per day, and many seniors easily exceed this through everyday meals, without even factoring in salty snacks like pickles. So why is sodium such a concern for aging hearts? When sodium levels are too high, it causes the body to retain fluid, which increases the total volume of blood circulating through your arteries. This raises your blood pressure, forcing your heart to work harder to pump blood. Over time, this constant strain can lead to hypertension, high blood pressure, left ventricular hypertrophy, a thickening of the heart's left chamber, and significantly increased risk of heart failure, stroke, or other cardiovascular complications. For seniors, this risk is amplified because many already live with salt-sensitive hypertension, a condition in which the body reacts strongly to even small amounts of sodium. In such cases, foods like pickles, canned soups, processed meats, and snack foods can push blood pressure levels into dangerous territory without warning. And it's not just blood pressure. High sodium intake can also interfere with certain medications, especially diuretics and ACE inhibitors, both commonly prescribed to manage heart conditions. High sodium can reduce these drugs' effectiveness, leading to poorly controlled blood pressure or fluid retention issues. Recommendation: if you're a fan of pickles, don't worry. You don't have to cut them out entirely. Instead, look for low-sodium or no-salt-added versions of pickled vegetables, which are becoming increasingly available in supermarkets. Or better yet, consider making your own pickles at home using fresh cucumbers, herbs, and vinegar, with just a fraction of the salt. Homemade pickles not only allow you to control sodium levels, but also give you the freedom to experiment with heart-healthy flavors like garlic, dill, turmeric, or peppercorns. Always check nutrition labels carefully, and when in doubt, compare brands to find the one lowest in sodium. Small choices like this can go a long way in supporting long-term heart health. Remember, a heart-healthy diet doesn't mean you have to sacrifice flavor. It just means making informed, mindful choices, especially when you're over 60 and your heart needs all the support it can get. Red chili peppers. Spicy but stimulating. Red chili peppers are beloved around the world for their fiery flavor and vibrant color. Whether added to soups, stews, sauces, or stir-fries, they bring a powerful kick that excites the taste buds. But behind that spicy thrill is a compound called capsaicin, which not only delivers heat, but also influences the cardiovascular system, sometimes in ways that may be problematic for older adults. On the one hand, capsaicin has gained attention in scientific studies for its potential health benefits. It's been linked to boosted metabolism, improved circulation, and anti-inflammatory properties, all of which can be positive for general wellness. Some researchers have even observed that individuals who consume chili peppers regularly may have a lower risk of heart disease or early death. However, these studies often involve large populations with widely varying diets and lifestyles, making it difficult to draw clear-cut conclusions, especially for people with pre-existing heart conditions. The reality is that for many seniors, especially those with sensitive cardiovascular systems, chili peppers can act as a stimulant, sometimes a little too powerfully. The most immediate concern is that spicy foods can cause temporary spikes in blood pressure and heart rate. This happens because capsaicin activates pain receptors in the mouth and gut, which in turn stimulates the sympathetic nervous system, triggering a stress-like response in the body. While this response is short-lived in healthy individuals, it can pose risks to seniors with conditions like atrial fibrillation, angina, or coronary artery disease. Additionally, chili peppers have the potential to trigger heart palpitations or arrhythmias, those uncomfortable fluttering or racing sensations that signal an irregular heartbeat. For someone already dealing with cardiovascular issues, even a brief episode of arrhythmia can be distressing or dangerous. Beyond the heart, there's also the issue of digestive sensitivity. Many older adults experience acid reflux, GERD, or irritable bowel symptoms, and spicy foods like chili peppers can exacerbate these conditions. Chronic heartburn, in turn, can disrupt sleep, increase nighttime blood pressure, and contribute to long-term cardiac stress if left unmanaged. So where does that leave chili lovers? Recommendation: if you're generally healthy and enjoy a bit of spice, you may not need to avoid chili peppers altogether. In moderation, they can be part of a flavorful, nutritious diet. However, if you have a history of heart rhythm disturbances, acid reflux, or you notice symptoms like palpitations, chest tightness, or digestive upset after eating spicy foods, it's best to reduce your intake and observe how your body reacts. Start with smaller amounts or choose milder varieties like paprika or banana peppers, which can offer some of the same flavor without the intense heat. And as always, consult your healthcare provider if you're unsure how spicy foods might interact with your heart medications or medical history. In short, chili peppers aren't inherently dangerous, but they demand respect and moderation, especially when you're managing your health in your golden years. Raw garlic, natural blood thinner with a catch garlic, has earned its reputation as a powerful superfood across generations and cultures. Known for its bold flavor and rich history in natural medicine, garlic has been used to treat everything from infections to high cholesterol. For heart health specifically, garlic has some impressive science-backed benefits. It can help lower blood pressure, reduce cholesterol, and improve arterial flexibility, all of which support cardiovascular wellness. But there's a catch, especially for older adults who are on blood-thinning medications. The main active compound in raw garlic is allicin, a sulfur-containing molecule released when garlic is chopped, crushed, or chewed. Allicin has several beneficial effects, including inhibiting platelet aggregation, the process that causes blood cells to clump together and form clots. While this can be helpful in reducing the risk of heart attacks and strokes in some individuals, it becomes problematic when combined with prescription anticoagulants like warfarin, Coumadin, clopidogrel, Plavix, or even low-dose aspirin. Too much blood thinning can result in dangerous side effects, especially for seniors who may already have fragile blood vessels, ulcers, or a higher risk of falls and injuries. When raw garlic and blood thinners work together too effectively, the result can be an increased likelihood of nosebleeds, excessive bruising, prolonged bleeding from minor cuts, gastrointestinal bleeding, internal hemorrhages, particularly if trauma occurs. This doesn't mean garlic must be eliminated from the diet. In fact, in moderate cooked forms, garlic is generally safe and continues to offer cardiovascular benefits. Cooking significantly reduces allicin content, thereby minimizing its blood-thinning effects. Roasted, sautéed, or added to soups and sauces, garlic can still contribute to heart health without pushing the balance too far. However, problems often arise when garlic is consumed in large quantities raw, such as in homemade health tonics, concentrated garlic pastes, or raw juice blends. Garlic supplements can also be problematic, especially those that contain high doses of aged garlic extract or garlic oil, which may not be labeled clearly for people on medications. Additionally, beyond blood-thinning concerns, raw garlic can irritate the digestive system, especially in seniors with sensitive stomachs. Side effects may include gas and bloating, heartburn, nausea, or stomach upset. This gastrointestinal discomfort can affect appetite, sleep, and general quality of life, especially if garlic is being consumed daily as part of a natural health regimen. Recommendation: seniors should enjoy garlic primarily as a flavorful addition to cooked meals, where its medicinal potency is tempered, but its taste remains. Avoid consuming large quantities of raw garlic, particularly if you're on blood thinners or have a surgical procedure coming up. Always talk to your doctor or a registered dietitian before taking garlic supplements or making major changes to your diet. In the right form and amount, garlic can still be a heart-friendly ally. But like many natural remedies, it must be used wisely and with awareness, especially when medications and age-related changes are involved. Raw sprouts. Tiny greens with a big risk. Raw sprouts may appear to be the perfect health food. Light, crunchy, low in calories, and full of plant-based nutrients. You'll often see alfalfa, mung bean, clover, and radish sprouts topping off sandwiches, or mixed into fresh salads at health-conscious eateries. However, what many people don't realize is that these miniature greens can pose a significant health risk, especially for seniors. The main concern with sprouts lies in how they're grown. Sprouts are cultivated in warm, humid environments, exactly the same conditions that encourage the growth of harmful bacteria such as E. coli, Salmonella, and Listeria monocytogenes. These bacteria are responsible for some of the most dangerous and widespread foodborne illness outbreaks in recent decades. For healthy younger adults, an encounter with these bacteria might result in mild symptoms such as diarrhea or stomach cramps. But for older adults, especially those over 60, or with weakened immune systems, diabetes, chronic kidney disease, or heart conditions, the consequences can be far more severe. Infections from contaminated sprouts can escalate into sepsis, kidney failure, severe dehydration, meningitis, or even death in extreme cases. The troubling part is that washing raw sprouts does not guarantee safety. That's because the contamination often begins inside the seed itself, long before the sprouts appear. Once bacteria are present, they multiply rapidly during the germination process, and they can't be fully eliminated with surface rinsing. And while sprouts are often recommended for their vitamins, enzymes, and digestive benefits, these nutritional perks do not outweigh the potential life-threatening risks for older individuals. Recommendation: if you're over the age of 60, have a compromised immune system, or live with any major chronic illness, it's safest to avoid raw sprouts entirely. Instead, consider cooked sprouts, which still provide nutrients but undergo heat treatment that kills harmful bacteria. You can steam, sauté, or stir-fry sprouts until they're fully cooked and safe for consumption. Being mindful about raw sprouts is a small change that could prevent a very serious health issue. Final thoughts: be selective and informed about vegetables. We wrap up this vital discussion on vegetables that may pose hidden risks to seniors. It's important to reiterate a fundamental truth. Vegetables are essential for a healthy, balanced life. But aging changes everything, from how we digest food to how our bodies respond to certain nutrients or medications. What once was healthy in our 30s or 40s may require extra consideration in our 60s, 70s, and beyond. This doesn't mean you need to fear your food. Instead, it's about being informed, selective, and proactive with your dietary choices. Knowing how your current health status interacts with what you eat can empower you to make better decisions for your heart, brain, and body. Here are some key takeaways every senior and caregiver should remember.